Which of the following statements about a laminar airflow hood is true? A. It should be regularly cleaned with alcohol-based solutions. B. It should be placed next to a window for natural light. C. It should be used to store non-sterile medication. D. It helps to maintain a sterile environment during compounding. The correct answer is D. A laminar airflow hood is essential in pharmacy sterile compounding. It helps maintain a sterile environment by providing a continuous flow of filtered air. What is the purpose of using a sterile needle and syringe in pharmacy sterile compounding? A. To measure non-sterile ingredients. B. To transfer sterile ingredients. C. To mix non-sterile liquids. D. To clean the work area. The correct answer is B. Sterile needles and syringes are used to transfer sterile ingredients during pharmacy sterile compounding to prevent contamination. Which of the following is not a required accessory for pharmacy sterile compounding? A. Alcohol swabs. B. Measuring cups. C. Gloves. D. Gauze pads. The correct answer is B. Measuring cups are used for non-sterile compounding and are not necessary for sterile compounding. What is the purpose of a sterility test in pharmacy sterile compounding? A. To check the pH of the compounded product. B. To confirm the potency of the compounded product. C. To ensure the product is free of microorganisms. D. To measure the osmolality of the product. The correct answer is C. A sterility test ensures the compounded product is free of microorganisms, confirming its sterility. Which of the following environments is considered ideal for pharmacy sterile compounding? A. Cluttered and dusty. B. Well ventilated and clean. C. Exposed to direct sunlight. D. Adjacent to a restroom. The correct answer is B. An ideal environment for pharmacy sterile compounding should be well ventilated, clean, and free from potential sources of contamination. What is the purpose of using sterile gloves during pharmacy sterile compounding? A. To protect the pharmacist from spills. B. To improve grip while compounding. C. To prevent contamination of the product. D. To keep hands warm. The correct answer is C. Sterile gloves are necessary during pharmacy sterile compounding to prevent contamination of the product with microorganisms from the pharmacist's hands. What should be done before entering a sterile compounding area in a pharmacy? A. Spray perfume for a pleasant fragrance. B. Remove jewelry and wash hands thoroughly. C. Eat food to maintain energy levels. D. Wipe hands on a non-sterile towel. The correct answer is B. Before entering a sterile compounding area, remove jewelry and wash your hands thoroughly to reduce contamination risk. Which of the following is a common method of sterilization used in pharmacy sterile compounding? A. Baking. B. Frying. C. Autoclaving. D. Freezing. The correct answer is C. Autoclaving is a common sterilization method in pharmacy sterile compounding. It effectively kills microorganisms using high-pressure steam. What is the purpose of using a HEPA filter in a laminar airflow hood for pharmacy sterile compounding? A. To cool the working area. B. To humidify the air. C. To filter out particles and microorganisms. D. To create a barrier from external airflow. The correct answer is C. A HEPA filter in a laminar airflow hood filters out particles and microorganisms from the air. This ensures a sterile working environment for pharmacy sterile compounding. Why is it important to label all compounded sterile products with the preparation date and pharmacist's initials? A. To meet regulatory requirements. B. To save time during future reference. C. To track medication expiration dates. D. To identify the patient receiving the medication. The correct answer is A. Labeling compounded sterile products with the preparation date and pharmacist's initials is necessary to meet regulatory requirements and ensure traceability in case of adverse events or recalls. What is the purpose of a clean room in pharmacy sterile compounding? A. To minimize contamination. B. To maximize contamination. C. To store non-sterile products. D. To enhance microbial growth. The correct answer is A. A clean room is essential in pharmacy sterile compounding to minimize contamination and maintain a sterile environment for compounding medications. What is the purpose of using aseptic technique in pharmacy sterile compounding? A. To introduce contamination. B. To maintain sterility. C. To increase microbial growth. D. To speed up the compounding process. The correct answer is B. Aseptic technique is used in pharmacy sterile compounding to maintain sterility and prevent contamination of compounded medications. Which of the following is a primary concern when compounding sterile products in a pharmacy setting? A. Patient comfort. B. Pharmacist convenience. C. Sterility. D. Appearance of the product. The correct answer is C. Sterility is a primary concern when compounding sterile products in a pharmacy setting, to ensure the safety and efficacy of medications for patients. Why is it important to use sterile water in pharmacy sterile compounding? A. To save costs. B. To minimize contamination. C. To improve the taste of the medication. D. To speed up the compounding process. The correct answer is B. Using sterile water in pharmacy sterile compounding is essential to minimize contamination and maintain the sterility of the final product. Which of the following is a common error to avoid in pharmacy sterile compounding? A. Not wearing gloves. B. Using expired ingredients. C. Mislabeling products. D. Skipping the aseptic technique. The correct answer is C. Mislabeling products is a common error to avoid in pharmacy sterile compounding, as it can lead to medication errors and patient harm. What is the purpose of a buffer zone in pharmacy sterile compounding facilities? A. To store non-sterile supplies. B. To prepare non-sterile medications. C. To provide a transition area between contaminated and sterile areas. D. To maximize microbial growth. The correct answer is C. A buffer zone in pharmacy sterile compounding facilities serves as a transition area between contaminated and sterile areas to minimize the risk of contamination during compounding. Why should pharmacy personnel be properly trained in aseptic technique for sterile compounding? A. To increase the cost of medications. B. To minimize the risk of contamination. C. To delay the compounding process. D. To complicate the preparation of medications. The correct answer is B. Proper training in aseptic technique for sterile compounding is crucial to minimize the risk of contamination and ensure the safety and efficacy of compounded medications for patients. Which of the following is an example of a critical site in pharmacy sterile compounding that must be disinfected regularly? A. The ceiling of the compounding area. B. The floor of the compounding area. C. The work surface where compounding is done. D. The entrance door to the compounding area. The correct answer is C. The work surface used for compounding is a critical site in sterile pharmacy compounding. It must be disinfected regularly to prevent contamination of compounded medications. What is the purpose of using closed system transfer devices in pharmacy sterile compounding? A. To increase microbial growth. B. To minimize the risk of contamination. C. To save costs on compounding supplies. D. To speed up the compounding process. The correct answer is B. Closed system transfer devices are used in pharmacy sterile compounding to minimize the risk of contamination during the transfer of ingredients and components, ensuring the sterility of the final product. Why is regular environmental monitoring important in sterile compounding pharmacies? A. To increase the risk of contamination. B. To reduce costs. C. To ensure compliance with regulations. D. To speed up the compounding process. The correct answer is C. Regular environmental monitoring is important in pharmacy sterile compounding facilities to ensure compliance with regulations and maintain a controlled environment to prevent contamination of compounded medications. What is the purpose of using a laminar airflow hood in pharmacy sterile compounding? A. To provide a sterile environment for compounding. B. To mix non-sterile ingredients. C. To speed up the compounding process. D. To reduce costs of compounding materials. The correct answer is A. A laminar airflow hood provides a sterile environment for compounding. It does this by maintaining a flow of filtered air that removes contaminants. What is the purpose of using a biological safety cabinet in pharmacy sterile compounding? A. To sterilize equipment. B. To store compounded products. C. To protect the environment from hazardous substances. D. To protect the compounding personnel and products from contamination. The correct answer is D. A biological safety cabinet protects compounding personnel and products from contamination. It creates a barrier between the operator and the work area. Which of the following is a method of disinfection commonly used in pharmacy sterile compounding facilities? A. Use of ultraviolet light. B. Spraying with water. C. Rinsing with tap water. D. Wiping with a dry cloth. The correct answer is A. Use of ultraviolet light is a common method of disinfection in pharmacy sterile compounding facilities to reduce microbial contamination. What is the purpose of using a sterile gown in pharmacy sterile compounding? A. To look professional. B. To keep the compounding area clean. C. To protect the pharmacist's clothing. D. To prevent contamination of compounded products. The correct answer is D. A sterile gown is worn in pharmacy sterile compounding to prevent contamination of compounded products and maintain a sterile environment. Which of the following is an example of a critical site that must be disinfected regularly in pharmacy sterile compounding? A. Ceiling of the clean room. B. Floor of the clean room. C. Shelves where supplies are kept. D. Countertop where compounding takes place. The correct answer is D. Countertops where compounding takes place are a critical site that must be disinfected regularly to prevent contamination of compounded products. What is the purpose of using a sterile syringe in pharmacy sterile compounding? A. To measure and transfer sterile liquids. B. To mix non-sterile ingredients. C. To clean the compounding area. D. To dispose of waste materials. The correct answer is A. A sterile syringe is used in pharmacy sterile compounding to measure and transfer sterile liquids accurately without introducing contaminants. Which of the following is not a required accessory for pharmacy sterile compounding? A. Sterile gloves. B. Safety goggles. C. Face mask. D. Non-sterile equipment. The correct answer is D. Non-sterile equipment is not required for pharmacy sterile compounding. All equipment must be sterile to prevent contamination. Why is regular environmental monitoring important in sterile pharmacy compounding? A. To keep the area clean. B. To ensure regulatory compliance. C. To save on cleaning supplies. D. To train new personnel. The correct answer is B. Regular environmental monitoring is important in pharmacy sterile compounding facilities to ensure compliance with regulations and maintain a safe compounding environment. What is the purpose of using a HEPA filter in a laminar airflow hood for pharmacy sterile compounding? A. To remove non-sterile equipment. B. To maintain proper air quality. C. To reduce noise levels. D. To save energy costs. The correct answer is B. A HEPA filter in a laminar airflow hood maintains proper air quality by filtering out particles and contaminants from the air. Why should pharmacy personnel be properly trained in aseptic technique for sterile compounding? A. To qualify for a promotion. B. To reduce costs of training. C. To prevent contamination of compounded products. D. To streamline the compounding process. The correct answer is C. Pharmacy personnel should be properly trained in aseptic technique for sterile compounding to prevent contamination of compounded products and ensure patient safety. What is the purpose of using an anteroom in pharmacy sterile compounding? A. To provide a transition area for personnel to change into sterile attire. B. To store non-sterile supplies and equipment. C. To conduct quality control testing on compounded products. D. To dispose of waste materials from the compounding process. The correct answer is A. An anteroom is a necessary space in pharmacy sterile compounding facilities. It's a transition area where personnel change into sterile attire before entering the clean room. This helps minimize contamination risks. Why is it important to maintain proper humidity levels in pharmacy sterile compounding facilities? A. To reduce the risk of microbial growth. B. To enhance the effectiveness of the sterilization process. C. To improve employee comfort. D. To prevent chemical reactions in compounded products. The correct answer is A. Maintaining proper humidity levels in pharmacy sterile compounding facilities is crucial to reduce the risk of microbial growth and contamination of compounded products, as high humidity can create an environment conducive to microbial proliferation. What is the purpose of using a laminar airflow hood in pharmacy sterile compounding? A. To provide a sterile environment for compounding sterile products. B. To store compounded products before dispensing. C. To mix sterile and non-sterile ingredients. D. To package sterile products for distribution. The correct answer is A. A laminar airflow hood is used in pharmacy sterile compounding to create a unidirectional flow of HEPA-filtered air. This provides a sterile environment for compounding sterile products, helping to minimize airborne contamination. Which of the following is an example of a vulnerability in pharmacy sterile compounding that must be addressed to prevent contamination? A. Lack of proper airflow in the cleanroom. B. Overuse of personal protective equipment. C. Quality control testing performed too frequently. D. Inadequate labeling of compounded products. The correct answer is A. Lack of proper airflow in a cleanroom is a vulnerability in sterile pharmacy compounding. It must be addressed to prevent contamination. Airflow is critical for maintaining a clean and sterile environment. Why is regular surface disinfection important in pharmacy sterile compounding facilities? A. To prevent microbial contamination of surfaces. B. To reduce the risk of employee exposure to hazardous chemicals. C. To enhance the shelf life of compounded products. D. To reduce energy consumption in the facility. The correct answer is A. Regular surface disinfection in pharmacy sterile compounding facilities is essential to prevent microbial contamination of surfaces. This can pose a risk of cross-contamination and compromise the quality and safety of compounded products. What is the purpose of a pass-through window in pharmacy sterile compounding? A. To transfer materials between clean rooms without compromising sterility. B. To provide natural light in the compounding area. C. To allow personnel to communicate with customers. D. To store sterile gloves and gowns. The correct answer is A. A pass-through window in pharmacy sterile compounding facilities is used to transfer materials between cleanroom areas without compromising sterility, helping to maintain the integrity of the compounding process. Which of the following is an example of a critical site in pharmacy sterile compounding that must be disinfected regularly? A. The ceiling of the cleanroom. B. The exterior of the compounding equipment. C. The walls of the anteroom. D. The surface of the laminar airflow hood. The correct answer is D. The surface of the laminar airflow hood is a critical site in pharmacy sterile compounding. It must be disinfected regularly. This prevents contamination of compounded products and maintains aseptic conditions during compounding. Why is it important to use sterile water in pharmacy sterile compounding? A. To prevent microbial contamination of compounded products. B. To enhance the solubility of active pharmaceutical ingredients. C. To reduce the risk of chemical reactions in the compounding process. D. To improve the taste of compounded products. The correct answer is A. Using sterile water in pharmacy sterile compounding is crucial to prevent microbial contamination of compounded products. Non-sterile water can introduce contaminants that compromise the safety and quality of the final product. What is the purpose of using a biological safety cabinet in pharmacy sterile compounding? A. To protect personnel and products from exposure to hazardous materials. B. To maintain proper humidity levels in the compounding area. C. To store sterile equipment and supplies. D. To facilitate communication between compounding personnel. The correct answer is A. A biological safety cabinet is used in pharmacy sterile compounding to provide a controlled environment. This protects personnel and products from hazardous materials. It ensures the safety of the compounding process and the integrity of the final product. Which of the following is not a primary concern when compounding sterile products in a pharmacy setting? A. Ensuring proper aseptic technique is followed. B. Maintaining accurate documentation of the compounding process. C. Minimizing cross-contamination risks. D. Adhering to regulations regarding non-sterile compounding practices. The correct answer is D. Adhering to regulations regarding non-sterile compounding practices is not a primary concern when compounding sterile products in a pharmacy setting. The focus is on ensuring aseptic technique, documentation accuracy, and cross-contamination prevention for sterile compounding processes. What is the purpose of using closed system transfer devices in pharmacy sterile compounding? A. To prevent contamination during drug preparation. B. To increase airflow in the compounding area. C. To sterilize equipment before compounding. D. To label compounded products accurately. The correct answer is A. Closed system transfer devices help prevent contamination by providing a closed, sterile pathway for transferring medications and ingredients. Why is it important to maintain proper humidity levels in pharmacy sterile compounding facilities? A. To reduce the risk of mold growth. B. To increase the effectiveness of disinfectants. C. To improve air quality in the compounding area. D. To prevent static electricity buildup. The correct answer is A. Proper humidity levels help prevent mold growth, which can contaminate sterile compounding areas and products. Which of the following is an example of a vulnerability in pharmacy sterile compounding that must be addressed to prevent contamination? A. Missing labels on compounded products. B. Regular environmental monitoring. C. Proper hand washing techniques. D. Sterile gloves usage. The correct answer is A. Missing labels on compounded products can lead to errors and potential contamination, making this a vulnerability that needs to be addressed. What is the purpose of using a sterile syringe in pharmacy sterile compounding? A. To measure and transfer sterile ingredients accurately. B. To decrease airflow in the compounding area. C. To sterilize equipment after compounding. D. To monitor temperature and humidity levels. The correct answer is A. Using a sterile syringe helps ensure accurate measurement and transfer of sterile ingredients to maintain the sterility of the final product. Why is regular surface disinfection important in pharmacy sterile compounding facilities? A. To improve air quality in the compounding area. B. To prevent cross-contamination and microbial growth. C. To maintain proper humidity levels. D. To decrease static electricity buildup. The correct answer is B. Regular surface disinfection helps prevent cross-contamination and microbial growth, reducing the risk of contamination in sterile compounding areas. What is the purpose of a pass-through window in sterile pharmacy compounding? A. To increase airflow in the compounding area. B. To label compounded products accurately. C. To transfer materials and products between non-sterile and sterile areas. D. To facilitate communication between pharmacy staff. The correct answer is C. A pass-through window allows for the transfer of materials and products between non-sterile and sterile areas without compromising the sterility of the compounding environment.